Well, as always, during the summertime, I'd like to remind everybody to wear your sunscreen and stay protected. Be smart when you're outside. And of course, if you do have sensitive skin, be sure to take care of it. Moisturize with a dental product that's fragrance free. And don't forget to see your dermatologist if needed. I think most dermatologists would agree with me that, picking a sunscreen is kind of like picking out a toothpaste or picking out a shampoo. I mean, there's lots of good choices out there, thankfully. Typically, though, you do want to look for something that's going to be SPF 30 or higher. Nowadays, it's usually pretty easy to find 50 or higher. It should say broad spectrum UVA, UVB, and water resistant up to 80 minutes. So those are kind of like the minimum things you're looking for. Now, in general, I think we would all agree that the physical blockers are better. So those are the ones that have zinc oxide and titanium dioxide in it. And that's because those physical blockers will actually scatter those UV rays rather than trying to absorb it. We know that in general, those are going to be better tolerated for people with sensitive skin. I know I've got lots of patients with atopic dermatitis, and they always do better with the physical blockers rather than the chemical sunscreens. And of course, if you're going to be at snorkeling on a reef, those are also going to be safer for the reef than the chemical blockers. But there are also lots of great chemical sunscreens out there, and you can pick the ones that have the newer ingredients, staying away from some of the old fashioned ingredients. The newer ones are generally better tolerated and seem to be safer. Again, don't use it if it burns or stings. And at the end of the day, the best sunscreen is the one that you're going to use. So pick one out that you're going to use.